The real mastermind behind the stroke is your emotions, your habits. Within half an hour, if you do this emergency treatment of getting a stroke, then half of the symptom will actually vanish. When you get angry, you are punishing yourself. Hi guys, in this video I'm going to talk about a very common disorder that we are encountering in today's world, that is a stroke or hemiplegia, that is partial paralysis. And we have seen a lot of cases of paralysis occurring across our country, and it is very common. And the problem with this disorder is that it occurs very randomly. People are not aware about it, when and where it can occur. The worst part is we are chasing a very wrong enemy when we are trying to prevent this disorder. And also, the way of treating this disorder is very less known to the people. So, first, let us understand what is paralysis. In simple words, paralysis is disablement of certain organs like muscles or your nerves are not working. So, suppose your left hand, you are not able to control it voluntarily, it is dead, somebody else has to pick it up, then that is called paralysis. So, a lot of different types of paralysis can occur. Depending on that, the names vary. So, if you have a paralysis of the face, when a lot of people, due to certain conditions, they have paralysis of the face. So the face paralysis is called Bell's palsy. So where one side of the face get paralyzed, so the muscles in this area are not working, and your other side is having too much of tension in the muscle, so the face pulls in one side. So the face which is flat, which is not having any contraction, is the paralyzed side, and the face which is having the pull is the normal side. This is not actually absolute, because we have sometimes in certain condition it actually reverses. I'm currently treating one case, and in this case the paralyzed side is the one that is pulled, and this happens over a duration of time, and the reasons are quite different, but we are not going to talk about that now. But let us understand what is Bell's palsy first. Then the second part is you have monoplegia, where only one limb, so left hand, right leg, left leg, only one limb is getting affected or getting paralyzed. Then it is, we have paraplegia, where mostly your legs, lower part of your body, or two limbs are getting affected. So most of the cases, when you have an impact of physical injury to your lumbar spine, or you have a slip disc, very severe slip disc, or sometimes during surgery, if it is not carefully done, sometime if it has affected the nerve roots, then also can cause paralysis of the legs, and that is called paraplegia. Also, there's another paralysis where it is half sided. Left side of your hand, left leg, left face is paralyzed, or right side is paralyzed. So depending on that, we are calling it hemiplegia. Hemi is half, so half side paralysis. So you have one side that is paralyzed. And the main topic of today is the hemiplegia. So this normally occurs when you have a brain stroke. There is a blood related issue, disorder of the blood or circulation in your brain. And the last type of paralysis is the quadriplegia, which is occurring below the neck. So if there is an impact in the brain or impact on the spine, that is above the thoracic spine, if that is occurring, then most of the time, if the spine is cut off, then you have all four limbs are paralyzed. So this can occur due to spinal injury. It can occur in disorders like muscular dystrophy. Also, it can occur in motor neuron disease or sclerosis. A lot of disorders have this kind of symptoms that are occurring with them. So today we are going to only focus on one case, that is the this hemiplegia. So hemiplegia is occurring, as I mentioned, is due to a disorder of circulatory system in the brain. So the brain is supplied with blood. So the blood vessels in the brain have two abnormal disorders or two abnormal conditions. One, if the pressure in those in those arteries or veins are too much, then it ruptures. The walls are not strong enough to hold the blood, and the pressure bursts that artery or the vein. Mostly it is artery. So if it ruptures, then it is causing the blood to flow, and when the blood goes out, it starts damaging the tissues around. So when the brain tissues are damaged, this mainly occurs in the cerebral cortex. So it is the most biggest thinking part of the brain that is there, or the motor part of the brain. So most of the time it is occurring in this area, and because it is occurring in the cerebral cortex, so as soon as it occurs, body starts recovering it as fast as possible, because it is very important. Because it that happens, then the whole body is losing its control. So as soon as there is rupture of vessel and the blood is coming out, the body finds a way to kind of stop that. But in some condition it is not able to do that, so you have to undergo surgery, or you enter into coma, or you might even lose life. So in this condition, it is very essential that you rush to the hospital, get the emergency things done, and the surgeons will make sure that the vessels are repaired and the blood is as much as possible is drawn out from it. Because the brain loses this important supply of nutrients, so the cells die. So because the cells die, that is why the body starts losing control over it. The motor control is lost, and you start developing hemiplegic or paralysis symptoms. This is one type, which is a very risky condition. So it is best to make sure that you don't encounter this. We are going to talk about some of the preventative means to do that. The second type is where the blood is inadequate. So the blood flow to certain parts of the brain, mainly the cortex only, the cerebral cortex. Blood supply is not sufficient, so the it kind of creates a vacuum. It kind of creates like collapse of the vessel, and that causes the lack of nutrition in that area, and that can also cause hemiplegic symptoms or paralysis of the body. So depending on if it is happening on the right side or the left side, you have respective paralysis of the body. So the if the stroke happens on the left side of the brain, then the body on the right side gets paralysis. And if it is happening on the right side, then the left side of the body gets paralyzed. So in that condition, when that happens, you start losing your face muscle first, then the tongue, you start losing the speech, then the hand starts getting numb, or you start losing control over it, and slowly also the leg. So if you lose speech, and if you are a right-handed person, understand this. If you're a right-handed person, if you're doing your work writing on the right hand, and if a paralysis or stroke happens on the left side of the brain, then the speech is very difficult to recover. But if same thing, if you're a right-handed person and the stroke happens on the right side of the brain, then your left side is paralyzed, then the speech will recover within 3 to 4 days. As far as the impact is concerned, if you're lucky enough, you might have the second type of stroke, and then it will only give you paralyzed, and you might not have a life threatening condition. But if the first kind of condition happens, you have to rush to the hospital as soon as possible. So when you get a stroke, first thing is, you actually, if you are observant enough, you start developing certain kind of, like, irritation or heaviness or tightness, or some kind of, like, minor electrical fluctuations in your brain that you notice. If you're ignorant about it, then you don't know that you are going to have stroke. So in those conditions, there are certain emergency treatment that you can do. And these emergency treatments, mostly an trained acupuncture doctor can help you with that. Within half an hour, if you do this emergency treatment of getting a stroke, then half of the symptom will actually vanish right there and there, and the impact, or the impact area of the brain that is going to get affected by the stroke is going to be less. Second thing about the recovery. So when you have stroke, in a normal condition, when you get second type of stroke, your body starts recovering right from the moment it realizes you have a stroke. So after the paralysis happens, it takes 3 to 4 days for the speech to recover, then the face muscles recover, and approximately around 30 to 40% of the recovery in paralytic condition, if you're lucky enough, if you are young enough, and if your brain and body response to recovery is fast, then 30 to almost 40% of the recovery is occurring within that 15 days to 20 days without actually doing any kind of treatment. But if you go to the hospital right at the moment and you start doing a lot of treatment, then sometime you realize that that treatment is actually doing the effect on your body, but actually it is not just that treatment, it is your natural process. This is how the recovery works. So we'll talk about treatment in the later part, but the most important part, why we get stroke. So this is a very important question that I want to address today, is because we have a certain misunderstanding. It is not misunderstanding, it's like half knowledge. Because what happens is we are told that the stroke or brain stroke occurs due to high blood pressure. That is one. Second is diabetes, high sugar content in the brain. Yes, these are true, but they are not the culprit, the actual ones behind the mastermind behind the stroke. The real mastermind behind the stroke is your emotions, your habits. Make it very clear. It is like, you are on a road and an accident occurred and somebody hit and run case and somebody is like there. You try to go and help him. Police comes, they see you, they think that you are the culprit because you are with the person that is injured, and they take you. And they are always investigating from your perspective. But the one who actually hit you and gone is gone. And it is too late to find him. So the hit and run is the emotions. And the person who's actually trying to, respond to that particular situation is the blood pressure and sugar, and they are the ones that are always targeted, and we are missing out the point that the emotions are the one that are responsible for creating the whole pressure syndrome. So I will explain in detail how it works. So let me take you back to your childhood. I don't know the viewers, but you, the age that you are, but you must have known about a cartoon called Tom and Jerry. This is the most relative thing that most people can relate to. So when you look at Tom and Jerry, you will notice that when Tom gets angry, the cat gets angry, it starts having this burst of energy in his head, and it's like shown as volcano or fire coming out of his ear and head and eyes and everything. So what is that? That is anger. So the anger, that emotion, is basically driving fire towards your head. So when fire goes up, what does fire do? It brings everything with it on top. So the blood flow increases, blood pressure increases, heart rate increases, everything goes on top because fire rises. So it goes to the head, and you know what happens when blood flow increases? We see the pressure is increased, we see the sugar increase, because the brain senses or the mind senses that it lacks sugar to sustain the need of the hour, to sustain that outburst of anger, to sustain that expression, to sustain that brain activity. You need more sugar. The sudden rush of sugar in the brain is what is seen as the culprit, but actual culprit is the emotion. What controls the emotions? Your liver. So according to TCM, your emotions are mainly governed by liver, and other organs have their particular contribution, but the main governor of emotions is your liver. So if your liver is the one that is causing those emotions to rise, last time we talked about our video on five elements, and in that five elements, we have mentioned about liver being the wood. So according to TCM, liver is the one that is the young fire. It is like, as soon as you have emotional imbalance, it creates that fire. Or if your liver is weak, you tend to get angry very easily. So that is the actual culprit behind the whole cycle of getting anger outbursts. So when you're angry, you don't realize what the impact that you are causing on the body. And when that happens, over a period of time, little by little, your vessels in your brain starts getting weaker. The control of blood pressure of your heart also starts getting weaker. And slowly, you start having a precursor to stroke. And someday, out of nowhere, You are yelling at someone or just yelled at someone, you are going back home, resting. At that time, you have a stroke. And you are like wondering, I don't have blood pressure, I don't have sugar, I don't have anything. Everything is under control. Why am I having this stroke? Even if you take medications for blood pressure, sugar, still you can have stroke. We have so many patients. You even have patients who have stroke, have no blood pressure issues, no sugar issues during the stroke, and everything is normal, yet they have stroke. So that is why I'm telling you, it is not the culprit. Focus on your emotional stability, your stress. And I have talked about stress a lot because that is one of the main concerns in today's society. So another thing that can occur is that when you are getting angry or you're suppressing emotion, your boss yells at you, your wife, you have an issue with her, you have problem with your family, you start suppressing certain emotions. So that suppression causes this pressure building up. So when that pressure builds up, you're kind of not eliminating the cause for it. You're not telling yourself, okay, this is normal and it should not affect you. This is life. You're not doing that. You are basically just, thinking about it, thinking about it, thinking about it. And this creates kind of certain mechanism in the body to go haywire, and it creates kind of a vacuum. It's very hard to understand because, when it comes to blood flow, there is energy or chi that is flowing with the blood. So when the chi is flowing, if there is this kind of disruption of energy occurring, then its energy is kind of in wrong place at wrong time, and right when you need it for the brain, there is a vacuum that is created in that blood vessel. So that vacuum that is created is what causes that inadequate supply of blood to the brain. And in Chinese medicine, it is termed as chung feng. Chung feng is like you are affected or like you're hit by wind. What it means by wind is that you're not lying under a fan or an AC and you have a wind and then you get stroke. No, it is that internal change of energy, or it's like that cyclone or that tornado that is happening inside your body, that disruption of energy that is happening is like a wind, and that has affected to the brain to cause a inadequate supply of energy. So that causes stroke. So understand very carefully your emotional, mental stability is very essential for you to stay healthy and not get a stroke, and not just consume medications and tablets to prevent the stroke. So that is a very wrong way to enter, because the more medication you take, the more damage you will cause it to liver, and the more you damage the liver, chances to predispose it stroke is much more. So try to understand, try to learn from your mistakes, that understand how to take care of your emotional and mental health. When you get angry, you're actually punishing yourself. Just remember that when you get angry, you are punishing yourself, your future self. So stop being angry, try to forgive and forget, and be happy, be healthy, and God bless you. Do subscribe to the channel and do share it to your friends and family, because stroke can occur to anyone anytime. So if they know what can cause the stroke, they can prevent it much better. Thank you so much.